the school of thought and just looking at the NCD that there's really two pathways of coverage, and having separate requirements. If you think about Zach just covered the route that people has historically interpreted to be sort of outpatient. I think there's still some verdict out on that one. We're waiting on clarification, but I think this part is clear, right? For the patients who are in the hospital and they are being discharged home with RAD device. We'll probably just call it RAD device to keep it straight in our brains, Rhonda, so we can
Yeah,
separate RUN from an IV.
right.
But the policy really does talk about the initial coverage for the RAD device, whether it's with or without backup, for the initial 6 month period if these two requirements are met, right? The patient's being placed, and it's both. It's not an or here, so you got to look out for the and the or. And the patient requiring RAD support within 24 hours prior to discharge. It's almost like going back to that chronic stable state for oxygen, right? If you were to do that comparison. And I think the idea is that a patient within 48 hours of discharge is probably going to be as optimally treated as they can.